All right. Thank you guys so much for joining us today. So sorry we're just a couple minutes behind here, but I hope you got extra time to warm up your lunch so you can join us for this lunch and learn today. My name is Tara Tovkaj. I'm a development associate here on the Children's Miracle Network team here at UF Health Shands Children's Hospital. And I'm so excited to be here today with Dr. Slayton, who is the division chief for pediatric oncology. I wanted to thank you all for joining us on our first Speaking of Miracles Lunch and Learn. We switched the time if you were a viewer last year to kind of fit the lunch hour, which I think is just more fun. But before we dive in and hear from Dr. Slayton, I wanted to share a little bit about CMN hospitals and the impact that we have here at our hospital in Gainesville. Thanks to incredible partnerships, programs, and events that fundraise for us all year. UF Health Shands Children's Hospital is our local member hospital of Children's Miracle Network Hospitals. CMN Hospitals is an international nonprofit organization dedicated to raising funds and awareness for children's hospitals. CMN Hospitals' founding pledge is to keep all donations in the area in which they are raised, and that remains the core of their philosophy. On the call here today, we have a great gathering, honestly, of partners, such as our friends from Dance Marathon at UF, FSU, our high school dance marathon programs. We have folks from Dairy Queen, Extra Life, Campus USA, Southwest Georgia Oil, McLean, Knight Transportation, Swift Transportation, Wawa, Remax, and so many more supporters of CMN. Throughout their partnerships with Children's Miracle Network Hospitals at UFL Shands Children's Hospital, they have the ability to serve the children coming to our hospital for medical care. With all funds going directly back to our hospital here in Gainesville, we are able to make an incredible impact on the lives of children and families who need advanced medical treatment. Every dollar we raise ensures our hospital is well equipped with the proper tools whenever children need them most. Your fundraising has helped purchase life-saving equipment, fund groundbreaking research, and provide funds for diversionary and social support programs that would otherwise not be possible. As we hear from Dr. Slayton, he will be sharing some more details about how he sees CMN funds in action every day at the hospital, whether that be through his day-to-day experience or his research. Before we get started, if you're tuning in on YouTube, the live stream, you'll have to be logged in to do so, but feel free to put questions in the chat. We'll be monitoring them as we go, and we'll have time at the end to ask Dr. Slayton your fantastic questions. And if you don't have the ability to log in on YouTube, you can text us. If you text chat live to 41372, you can ask questions throughout. And let me put that phone number up on the screen here just for if you have any questions, you can use that phone number to give us some questions live, and we'll be able to answer them here at the end. But with that, let's hear from Dr. Slayton. So tell us about yourself, Dr. Slayton, and your journey and education and how that led you to your current role.
Hi, everybody. So my name is Bill Slayton, and I'm a pediatric hematology oncology physician. I have been working at the University of Florida since 2002, and I've been the division chief for our group since 2007, so going on 18 years. And I have seen the many benefits of Children's Miracle Network on our patients. So I was going to tell that story by telling you a few things that I've witnessed, and then I'm going to tell you the story of one of my patients. Back when I started at UF in 2002, our patients were housed in Unit 45 alongside all sorts of other patients. And our nursing staff really didn't have the specialized skills to give chemotherapy to pediatric cancer patients. And in 2011, the bone marrow transplant unit was going to move into the new hospital across the street, the North Tower. So we asked the College of Medicine and the hospital whether they would be willing to let us use the former bone marrow transplant unit as a dedicated unit for pediatric oncology patients. And, we didn't get an answer right away, but they announced at the Celebrity Waiters Night, which was a CMN event, that they were going to use the funds that were raised that year to renovate our unit. And my chair at the time, Richard Bussarelli, called me. He was in tears of joy, because we were getting the funding to renovate the unit. And that unit was the first of several renovations that were part of the Children's Hospital becoming modernized. And so that funding came in a large part from CMN. Um, and, fast forward another 5 years, we also inherited the bone marrow transplant clinic, which was our infusion center in our clinic. But it was not updated, it was not child friendly. And again, CMN funding and the CMN fundraisers came forward and raised money to renovate our outpatient unit in our infusion center. And it provided us the ability to, for the first time, give infusions where there was privacy, because the prior infusion room, essentially patients were separated by curtains, and it was, you can imagine, it was fairly noisy, and um, there was not a lot of ability to separate people from an infectious disease perspective. So those were two major accomplishments that were underwritten by CMN funds. And so, of course, I feel very indebted to CMN for that work. But CMN doesn't just pay for bricks and mortar upgrades. So they also help pay for equipment that we use, equipment that, for instance, Child Life uses to help our patients get through their procedures. And we have special equipment also that our physical therapists use and our occupational therapists use, that's underwritten by CMN. CMN also pays to support our child life our child life professionals, and in fact, uh, uh, they pay for most of the salaries of our child life specialists who help our patients get through procedures. They've paid for a psychologist for our oncology patients. And you can imagine children who are facing life threatening illnesses, what the benefit of having the access to a psychologist would be. And finally, CMN has funded our faculty members and their research. And our division is doing research, developing vaccines for certain types of cancer that would otherwise be fatal, things like glioblastoma, relapse medulloblastoma, and other types of brain tumors. And we're expanding those vaccine trials into um, uh, providing tumor vaccines for patients with bone tumors like osteosarcoma and Ewing sarcoma. So that research is also underwritten in part by CMN. So it really supports all the facets of the work we do for our patients. And so for that reason, um, my whole team thanks all of you for being willing to support CMN, and for being part of this great family of funders. My three children all participated in dance marathon as high school students and as college students, and there's something very magical about dance marathon, and the experiences you all have with your miracle kids and miracle families. Um, so I did have a short little presentation about one of my patients. I'm wondering if that has been loaded into the system.
It has, it has. We're gonna try to present them now. Let's see. Slides. Oop, not me.
Okay. So this little guy is one of our wonderful, beautiful patients who um, I think his journey really exemplifies what we try to do as a division. And I actually told a story as when I was telling people about interdisciplinary care in pediatric oncology. Another way to say that is teamwork. We work as an amazing team at UF Health to, to help cure our patients. And sometimes our patients have problems that are pretty daunting. And that was the case for this little boy. His name is Aiden Price. And when I met Aiden, he was 2 years old. And I had gotten a call from the hospital in Tallahassee about this little boy who had been less active than normal. And his mom was really worried about him and brought him to Tallahassee Memorial, where he was really, really sleepy. And they ended up getting a scan of his head, which showed that he had multiple bleeds in his brain. And he was found to have a white blood cell count of almost 1 million. And it's normal to have a white count of up to 15,000. But these white blood cells were circulating through his body, and when they were getting into his brain, they were plugging the blood vessels and causing bleeding. Next slide, please. And so Aiden was found to have something called T cell acute lymphoblastic leukemia. T cell acute lymphoblastic leukemia is a disease that, when I started my career, it killed about a third of the patients who had it. But now that I am in my, I've been doing this for a quarter of a century, we now are curing over 90% of the patients. But Aiden came in with specific problems that were very challenging. When he arrived at the hospital, he came through the emergency room, and one of his pupils was a lot larger than the other. We call this a blown pupil, and that suggests that there was pressure on his brain that was causing the brain to herniate through the little hole at the bottom of the skull. And that herniation is something that frequently is what happens just before somebody dies from a brain bleed. And so I met Aiden down in the emergency room with my two colleagues, Dr. Wynn and Dr. Black. And Dr. Wynn went to the lab with Aiden's blood, and Dr. Black went up to the ICU to tell them about this patient. And I rode down with him to the CT scanner where a CT confirmed that his brain was herniating. And then I rode up with him to the ICU, and we were greeted by about 20 people, including the general surgeons, the neurosurgeons, um, a whole slew of residents and fellows who were trainees, but we were all working together to resuscitate Aiden. We ended up putting him on a ventilator, and the neurosurgeons had to drill a hole in his skull to monitor the pressure, and they eventually they cut a window in the front of his skull to relieve the pressure of the bleeding. And during that night, we gave him platelets and we started his chemotherapy because within 2 hours, the hematopathology lab told us that he had T cell leukemia. And Aiden survived the night. And within a week, he was starting to respond to his mom. And we're like, well, maybe Aiden is still there. And eventually he was taken off the ventilator and we were able to continue his chemotherapy. But he had to wear this helmet. You see this little helmet because he had that window in his skull and we didn't want him falling and, essentially bruising his brain. This little girl is his twin, and you can see how chemotherapy not only does it affect the cancer, but while you're getting it, it affects your growth. So his sister started to outgrow him, and she essentially was taller than he was at the end of his chemo, but he's now taller than she was. So he's had a lot of catch up growth. And then this is his older brother. But Aiden loved coming to see us because we had all these people to take good care of him, and we had a child friendly unit. He eventually had to see the ophthalmologist because he had some bleeds in the backs of his eyes, and those clots had to be evacuated so he could see normally. Next slide, please. And after 2 years of chemotherapy, Aiden rang the bell. He got his diploma, and this is a small part of his team who celebrated his end of therapy with him. Next slide. And remember, he had this window cut out of his skull, so they had to replace the bone at the end of therapy, and that was done by our plastic surgeons. Next slide. Next slide.
It looks like it is. Oh, wait,
There
there
it
it is.
is. So you can see right after surgery how beautifully our plastic surgeons took care of this. The suture lines are right at his hairline here. And, he was up and playing in the playroom within a few hours of his surgery. Next slide. And 3 years off therapy, they honored Aiden at the Gator game. What was so amazing was the Gator players were so fascinated by him that they sort of stood aside as he was introduced, and then they all came running up to him and they gave him high fives and they gave him some of their paraphernalia, But they were so excited to meet Aiden, and this is my family with Aiden's family watching the game up in the stands. Even though he's from Florida State territory, Aiden's definitely a Gator fan, as you can see by his glasses. So the point I want to make is that we really strive hard to work as a team to provide the very best care that we possibly can for our patients. But to do that, we need the right personnel, we need the right therapies, and we need to have a children's hospital that's friendly, and we need to have all the support services that we need to get a patient like Aiden through his treatment. Physical therapists, psychologists, child life specialists, and all of the equipment that they need to do that. And Aiden benefited from having a beautiful inpatient and outpatient unit to get his treatment in. So with that, I'm gonna close, and I do want to thank you for supporting Children's Miracle Network, and I'm open to any questions you might have.
Thank you so much for sharing that story and bringing some adorable slides with photos, Go Gators photos. I'm glad that even though they might be in the Tallahassee area, they still are Gator fans. I'm biased, but
Uh,
we do have one question right now. And feel free, anybody that is watching on the YouTube, again, you can put it in the comments or you can text the number that's on the ticker on the bottom of the screen there. But Dr. Slayton, one of our viewers wants to know, what is the most rewarding part of your job?
Gosh, it's amazing to see these kids grow up and see what they're doing with their lives. Today, I just saw one of my patients who just had a baby, and she's married. Her husband is in the military, um, but to see my patients become parents, to see them go to school and become OBGYNs, for instance, or work for the defense. I have a computer whiz who is working for the Department of Defense, protecting our country against hacking and stuff like that. Um, I really love to see what happens with my patients, and to watch them grow and become adults. It's just really special.
That's so awesome. And we do have one more question. What drew you to pediatric medicine in particular?
Well, I love working with kids, and I think I actually thought about doing some other things. I thought about becoming a wildlife biologist, and I checked that out for a little bit, and I'm like, no, I want to work with kids. I got kind of tired of counting animals, and my dad was an oncologist, and I think that over time I was just kind of drawn to the field of oncology. It's definitely a challenging field, and it can be a very sad um, place to work, but it's also quite an amazing place to work, and we to be able to help people who are suffering in the way our patients are, and to cure so many of them is extremely rewarding. That's all I can really say.
And one final one, is there anything else you'd like to share with our viewers and our CMN supporters that may be watching right now live or may watch it later? We have so many great partners in our area that do this voluntarily on top of their job description. They might be cashiers at Ace Hardware, and they are going to round up this holiday season. Any inspiring words to share with them before we hop off today?
Well, um, one of my patients, named Nina Karlinski, she was a dancer and a UF student, and Nina had she developed leukemia while she was a freshman at UF, and one of the most inspiring things that I got to see was how much she loved Children's Miracle Network and Dance Marathon. Her miracle child and his family came and visited her while she was in the hospital. And, talk about a turnaround. But that was really amazing to see. And Nina insisted on going to Dance Marathon, and she actually spoke um, at, and I got to go up there and be with her on stage while she spoke. But unfortunately, she died about 2 weeks after that. And her mom has carried on and been raising money in Nina's name for the last 6 years or so since Nina died. To me, that says it all about Children's Miracle Network, and how what we give, we get in spades back in terms of passion and um, we get to see the beauty of humanity by participating in the CMN events. And of course, I'm so thankful to Nina and her mom. And Nina's mom now works as a psychologist in our division, so she's giving back in that way as well. Um, so yeah, I think CMN is one of the most amazing things, and um, I really appreciate the fact that all of you are putting your time and heart into supporting our kids.
Thank you so much for spending time with us here today during your lunch break. I know you have a busy day over at the hospital, but we really appreciate your time and your insight and your inspiration for our partners and programs. I'm excited to continue this series. If you want to tune in, we're going to send out another one in November with another speaker. But Dr. Slayton, thank you so much for your time today. We always love having you share about how much you love Children's Miracle Network and how much you see the impact within our hospital walls. So thank you so much, everyone, for tuning in. We're going to end the live stream. If you have any questions, you are welcome to continue putting questions in the chat, and we will respond to them on YouTube. Thanks so much, guys.
Bye, everybody.